IRE is one of the more exciting new tools that we have for targeted tissue ablation. Ablation means that you're destroying something in a spot. There are a couple of ways in we can treat cancer. One of them is we release particles through the bloodstream that go out to the cancer and bathe that entire area with tumor-killing drugs, and also ones that shut off the oxygen to the tumor. And that's good if you've got to treat a field. But there are times when we're going to treat one spot, like cleaning a spot on the carpet. And that means that we have to either heat or freeze or inject things into that. Now, what IRE is, irreversible electroporation, is actually using certain very specific types of electricity through tiny needles to actually destroy cancer and tissue in that area. So another way to think about it is, if you've got an area that you want to get rid of, spot on the carpet, you can put a fence around it. And then everything inside of that fence is destroyed by virtue of that electrical field that is specifically created.
Once the patient's asleep and we have the area cleaned off, we do a CT scan to choose our exact entry and exit points so that we know where we're going in with the probes. Once we've done that, we sit and we do a calculation to determine how many probes we're actually going to have to place and where they're going to be. Then under CT guidance, we insert these needles, usually somewhere between 2 and 10 needles, again, depending on the size and location of the tumor. Once we've placed the needles and confirmed their location, again, usually with CT, we will do the ablation procedure, which essentially is we hook these probes up to a generator, which introduces the electrical current into the patient and zaps the tumor. And once the tumor's zapped, then the probes are withdrawn. Oftentimes we'll do one final CT just to make sure that there was no unexpected bleeding from the procedure, and then the patient is woken up, and then they go to the PACU for recovery, which is just a post-anesthesia care unit. And usually within 4 hours, the patient's up, walking around, eating. We watch these patients overnight and send them home the next day. So the procedure itself oftentimes will be between 2 and 4 hours of anesthesia because it takes a long time to get the probes in place. Now again, if it's a small tumor, it's going to be closer to 2 hours. If it's a big tumor, it's going to be closer to 4 hours. For patients who are considering IRE, I think the most important thing to search out is a physician with experience. And that experience should be both in IRE as well as in other minimally invasive procedures, so that they can be adequately counseled on not just the risks and benefits of IRE, but potentially the alternatives of other technologies and treatments that may be of equal or better benefit. The other thing to consider is that depending on the tumor, there may be surgical or radiotherapy options that should also be considered. I think that the most important thing, if you're actually going to have an IRE procedure done, though, is that you have it done with physicians who have a pretty good track record of treating patients with minimally invasive approaches.
So this is a very new technology, and we're very excited to be at the front end of this because of what we think it'll offer patients. It's approved for all soft tissue ablation by the Food and Drug Administration, the FDA. And we're at the start, and hopefully among the lead, in looking at what types of tumors. Are they liver tumors? Are they other soft tissue tumors that we can better get at with this than with some of the other ablation tools that we're very expert at using? Ones that may be difficult to reach, particular types of cancers that may be more responsive, the ability to maybe treat a cancer that's against something else, parked up close against another car, where you want to just get this and not that. And we think that this type of technology is going to give us some advantage in treating a cancer that may be up against something else that we want to save. Or that other thing may make it hard to treat with other tools just because it's there. So this may allow us to get right up against the edges of things better than other tools. And that's one of the reasons that we're really excited about this.